Welcome. Today we're going to talk about inactivity, proactive health communication plan. The objectives in this discussion are as follows. It will involve geographical statistics, causes of inactivity, physiological dangers of inactivity, theoretical reasoning related to inactivity, strategical interventions to overcome inactivity, overview, and reference. Our focus of inactivity will involve the state of New Jersey and the county Middlesex. New Jersey ranks above the national United States average of 22% for inactivity, especially in Middlesex County region. Now, in terms of inactivity and the risks in New Jersey involving Middlesex County, it ranks about 24% above the national United States average. Chronic increase in medical physical costs related to health problems is the resulting cause due to inactivity. Inactivity in New Jersey above the United States average. Now, when you look at this graph, if you compare United States, New Jersey, and Middlesex County, in the year 2013, they rank about 24%. So this is an example of a graphical representation of how inactivity is above the national average in New Jersey, Middlesex County in comparison to the United States. Effective health communication involves the transformation of health knowledge into messages which can be readily understood, accepted, and put into action by the intended audience. This requires a two-way flow of information between the sender of health messages and the audience. Technology is the leading cause of inactivity. Today, many people use computers in comparison to physical means of communication within the public sector. Communication involves the sharing of ideas, knowledge, attitudes, and feelings. But efforts to communicate health messages do not always achieve the results intended. Media accessibility is also a cause of inactivity. Now, in reference to inactivity, there are physiological results that can occur. Communication breakdowns of this kind does not have to happen. They can be avoided if communicators first try to understand the attitudes, beliefs, and social factors that determines people's health behavior. The activated health education model. Now, if you look at this diagram, this is a three-phase model that actively engages individuals in the assessment of their health. It creates awareness of the target behavior and facilitates its identification, clarification of personal health values, and develops a customized plan for behavioral changes for the client. Social cognitive theory. Social cognitive theory, according to this theory, there are three main factors that affect the likelihood that a person will change health behavior. which are self-efficacy goals and outcome expectancies. If the individuals have a sense of self-efficacy, they can change behavior even when faced with obstacles. Inactivity strategies. The Guide to Community Preventing series recommends 6 population-based strategies for increasing a population's level of physical activity. The first involves community-wide campaigns, which involves large-scale, highly visible, multi-component campaigns with messages that promote to large audiences to diverse media, including television, radio, newspaper, movie theaters, billboards, and mailings. It's important that we use these type of media in order to reach our audience. The information will help you identify the target audience, most credible sources of information about health and their access to various mass media and interpersonal communication channels. It will also alert you to potential communication conflicts such as misleading advertisement and incorrect health advice by influential people such as community leaders, traditional healers, and even trained health workers. With this information, you may be able to design health messages for these groups and possibly head off conflicts even before they occur. Number 2 involves individually targeted programs. Programs tailored to the person's readiness for change or specific interest. These programs help people incorporate physical activity into daily routines by teaching them behavioral skills such as setting goals, building support systems, rewarding themselves for small achievements, solving problems, and avoiding relapse. It's important that we do provide such an environment for our clients in order to achieve goals not related to inactivity. It's essential to know your audience. You must be familiar with your audience, presence, health behaviors, and with their attitudes, beliefs, and social factors, which will determine this behavior. This information will help you design health messages which build upon existing knowledge and beliefs of the target audience. It will also serve as a useful base for the evaluation of the program at a later stage. Number 3 involves social support for physical activities in community settings. Interventions that provide social support for physical activity in community settings. Interventions designed to promote physical activity by helping people create, strengthen, and maintain social networks that support their efforts to exercise more. Examples include exercise buddy programs and the establishment of exercise contracts or walking groups, which can occur in the work setting or in community centers or other social intervention within the client's community. The goal is to increase activity and to strengthen their support system. Number 4 involves physical activity interventions. Interventions to provide people greater access to places for physical activity. Example includes bike trails, building walking, and making exercise facilities available in the community centers or in workplace. We can also involve families involved in these interventions, which will create an even stronger support system. Number 5 involves employment interventions. It involves encouraging employers to adopt policies to support physical activity and good nutrition, such as offering flex time and providing healthy food options at work site cafeterias. It's important that we notice that sitting down at desks, as you notice at the diagram that is shown in the slide, is not actually good for the client. It actually leads to a lot of health problems later on. So if you can provide walk breaks or 10 to 5 minute walk breaks around the office or outside of the office, that will actually help the client physically in the future as well as their work production. It's important that clients remain active as much as possible, not stationary. This is the goal to avoiding inactivity. Number 6 involves promoting healthcare policies. We can promote these healthcare policies by giving positive goals to the providers that will implement these healthcare policies to clients, such as reimbursing providers for preventive care and basing a healthcare system quality of care rating at least in part of the quality of the preventive care it provides. So, in other words, we can reimburse providers for giving clients healthy programs, implementing work apps and other interventions that could be used within the community and also in the healthcare setting to decrease inactivity among clients. And they can actually be capitalized by giving the physicians and NPs a capital incentive for these programs, which is a benefit to them and long term to the client. In conclusion, in review, as state health departments attempt to coordinate the efforts of various categorical programs promoting physical activities, new, more effective strategies are likely to emerge. Through multiple mechanisms and with the help of many partners, the CDC stand ready to help state health agencies identify the most effective strategies so comprehensively addressing the inactivity epidemic in the United States. Now, we started as a partial mammal into human beings. The goal is not stationary, it's activity. Activity is the key to these programs. And if we work as a unit with the community as well as the health sector, we can achieve these goals in terms of making people more active instead of stationary, which is a benefit for them down the road and for their health. Thank you for reviewing my presentation. Included are some references that were used to put my presentation together, and I hope you enjoy it. Thank you.